Moving now to the United States, and health officials say they will begin offering booster shots to all Americans exactly a month from now. Let's bring in now Peter Pitts, former Associate Commissioner of the U.S. Food and Drug Administration, joining us live from New York. Professor Pitts, thank you so much for joining us. In your view, is this the right time for the booster shot, especially with the Delta variant and the Lambda now a variant of interest?
Yeah, as you mentioned, Rico, the science on booster shots is still very young. We don't exactly understand how soon after the initial double injection for the mRNA vaccines a booster shot should be given. The U.S. government is saying 8 months because we have 8 months of data. But whether it's 8 months or a year, I think ultimately it will be a year. It'll be a yearly booster shot. The issue is that we need to protect our citizens, and the world needs to protect its citizens from a recurrence of the COVID-19 relative not just to the Delta variant, but to the variants that are yet to come. COVID-19 is a very wily virus. Viruses mutate to survive, and we will see more variants as time goes on. So I believe it's prudent to give booster shots to everybody that's been vaccinated. The big issue in the U.S., in addition to selling the need for booster shots to the vaccinated population, is to vaccinate the unvaccinated population. Otherwise, we're going to have what we call a pandemic of the unvaccinated. And that cannot be acceptable. We've got to vaccinate everybody. And then after 8 months or a year, give everybody a booster shot. I think that's where we're going. And I think that we'll have success getting that done.
And still quite a lot of Americans are unvaccinated. And the ones who are currently being admitted to the hospital are the unvaccinated ones. Tell us, explain to us about a potential booster shot in the next few months. It is a third dose. Is it just like the first and second dose, or is it a separate, unique shot with stronger elements?
The actual rules on the dosage has not yet come out of the FDA. But from what I understand, for the 2 mRNA vaccines, it will be a third dose of 100 micrograms. So when you get the initial double vaccination of either the Pfizer-BioNTech or the Moderna vaccine, you get 2 vaccinations. Each vaccine has 100 micrograms. So the booster shot, which would be a third shot, would also be 100 micrograms. And we're still waiting for the data on the Johnson & Johnson single-dose vaccine. And I suggest that that'll probably also be a booster shot equal to the first dose. But the key here to understand is that we've got to make sure that the vaccinated population does not suffer from breakthrough infections, because what we want to do is keep people alive. We want to keep people out of the hospital. And one fact that needs to be driven home again and again and again is that the difference between the vaccinated and the unvaccinated relative to the Delta variant is if you're vaccinated and you get a breakthrough infection, which is unlikely but certainly possible, and it is happening, you will have a much more mild case of COVID-19. If you get the breakthrough variant and you get infected, you're going to the hospital, it's going to be pretty ugly, and we want to avoid that. It's bad healthcare and it's expensive.
Being a former FDA Associate Commissioner, Professor, how soon do you think will the FDA approve this booster shot?
I suggest, and I think with some knowledge, that the FDA will approve the booster shots probably by early September. And I think in that same time frame, they will issue full approval for the 3 vaccines, the Johnson & Johnson, Moderna, and Pfizer-BioNTech vaccines. Right now, they're being used under an emergency use authorization. I think that when the booster shots are approved, the FDA will probably also fully approve the vaccines for general use.
All right, and basically fully approved from the current emergency use. I would like to bring the context here to the Philippines, Professor Pitts, because many Filipinos have been immunized with China's Sinovac, which is an inactivated vaccine with basically an efficacy rate of between 50 to 70%. And there have been reports that those immunized with Sinovac have very low antibody counts. In your perspective, is there a need for a booster shot with those who have been immunized with Sinovac?
One of the issues with the Sinovac vaccine is that the Chinese government didn't really share a full data set, so we understand, in great detail how the vaccine works, how effective it is. But if you say 50%, let's just use that as a point going forward, I would say absolutely, positively, without any doubt, a booster shot is going to be necessary. If it's necessary for mRNA vaccines that are 95% effective, and the J&J vaccine that is 65 to 70% effective, any vaccine that is below that, such as the Sinovac vaccine, is absolutely going to need a booster shot.
Thank you so much for your perspective and for joining us on The Final Word. Peter Pitts, former Associate Commissioner of the U.S. Food and Drug Administration, joining us from New York.